and a proud member of Delta City of Vegas, which is not in, but we're really grateful that she chose to spend her time with us here this morning to moderate our phenomenal panelists who are moderators. Good morning. Y'all can do better than that. Good morning. All right. So this is going to be a great conversation today. Thank you to the Regional Health Commission for having us. Laura and I have tag teamed quite a few times over the years. So this should be interesting for us and for you all. So we're going to go ahead and introduce our panel. Our topic today is going to be Medicaid and reproductive health. And to talk and have this conversation with us, we first have the Senator Jill Shue. Jill grew up in a family like so many other Missouri families. She, her older brother, younger sister, and hardworking mom and dad lived in a small 2-bedroom, 1-bathroom home. They didn't have much, but certainly none of the children knew that. As with so many other families around her, there was an unspoken drive to make things a little better for kids for the next generation. Jill and her siblings were among the first in their family to go to college. They had each inherited their parents' strong work ethic, creativity, and desire to make the community a better place. Jill changed careers from teaching to advertising, where she met her husband. She and Mark recently celebrated their 36th anniversary. Hello, Mark, too. I like that. Jill and her husband worked, and she volunteered and served as Parent Association co-president in the elementary school their 2 young boys attended. When the board and superintendent turned their backs on changes she and other parents believed were needed in their schools, she knew she had to run for the board to have a seat at the table. She won and found ways to work with other board members while engaging the public to achieve 6 platform items she had run to accomplish during her 2 terms of service. She successfully ran and served on her city council, then ran and won 3 terms in the Missouri House. Not 1, not 2, but 3 terms in the Missouri House. And is in her 2nd term and final few months in the Missouri Senate. She has spent the last 22 years in public office because she believes things can and should be better for Missouri. She deeply cares about children and families. As a first-time grandparent of 5-month-old Sophie and daughter of 91-year-old Joan, Jill sees clearly that the work she has done to help provide children and their families access to good health and the opportunities it allows is at the heart of changing lives for the better. Among the bills she has passed as a state legislator to help Missourians with their healthcare needs, listen up, guys: suicide prevention in schools, suicide prevention training for mental health professionals, prohibition of surprise billing in network emergency. Let me say that again. Prohibition of surprise billing in in-network emergency rooms, trauma-informed care programs for children, criminalization of revenge porn, Nathan's Law, which promotes safe daycare, maternal mortality review board, social and emotional learning pilot programs in schools, extending mental health coverage with postpartum depression care act, Justice for Survivors Act, child care worker criminal background checks, EpiPen availability in restaurants with liability protections, EpiPens on school buses, Victims Economic Security and Safety Act, sometimes called VESA, Farm to Food Bank Program, Survivors Bill of Rights, Get the Lead Out of Schools Drinking Water Act. Beyond her elected service, Jill has committed to serving the unhoused and those with mental health challenges, working with Veterans Community Projects in St. Louis City. The Senator Jill Shue is one of our first panelists. Our second panelist is Dr. Melissa Tapey. We're going to do a big round of applause at the end of our board, just so that you guys know. Dr. Melissa Tapey is the Chief Medical Officer at Affinia Healthcare in St. Louis, Missouri. Dr. Tapey grew up on a farm in southern Illinois, an hour outside of St. Louis. She graduated from Yale University in 1998. She completed her MD from Albert Einstein College of Medicine in the Bronx, New York in 2005, as well as a master's in public health at Columbia University during medical school on an academic scholarship. Dr. Tapey completed her residency in obstetrics and gynecology at Washington University Barnes-Jewish Hospital in 2009. She began as an OBGYN at Affinia Healthcare in 2009, one of the largest community health centers in Missouri, and still considers this her dream job. She is a fellow of the American College of Obstetrics and Gynecology and volunteer clinical faculty in the Department of OBGYN at Washington University. In 2014, she became Chief Medical Officer at Affinia Healthcare. Her collaborative work in the region with a program called Elevate Women in maternal child health enhances her work from the individual patient level to a broader office, community, and state level. The Elevate program centers the patient as well as equitable health outcomes for Black moms and babies, incorporates mental health and social determinants of health, and includes clinician education on bias and racism. Collaborative advocacy for care coverage and access is a passion. As CMO, Dr. Tapey leads work in many areas of primary care, including Affinia's response to the COVID-19 pandemic and other chronic conditions, including diabetes, hypertension, mental health, substance abuse, and pediatric care. She is honored to work with dedicated, compassionate, and intelligent individuals every day that make the choice to believe and serve our mission to provide high-quality health care and exceptional service while promoting healthy lifestyles and equitable health outcomes. Outside of work, she loves to relax on the family farm, enjoy new restaurants with her husband, attend every event of her children, Olivia and Maxwell, garden, and read great historical fiction.
I think I'm as tall as Dr. J. So I have the pleasure of introducing two additional panelists this morning. Dr. Jennifer Wessels. Dr. Jennifer Wessels is a family medicine physician who obtained her MD degree from St. Louis University School of Medicine and completed her residency at Mercy Hospital in St. Louis. She has practiced in St. Louis for more than a decade in general primary care, hospice medicine, and correctional medicine. Dr. Wessels has been the chief medical director for home state for over 3 years. She also serves as adjunct professor at St. Louis University School of Medicine and volunteers at the St. Louis University Health Resource Center, serving vulnerable patients. She lives in the St. Louis area with her family. Last but certainly not least, Lakeisha Red. Lakeisha is a full spectrum community doula and community health worker who owns virtuously birth. Did I get that right? Birth. Y'all got to see the spelling of that. Birth. It's B'', doula services. And through this, she provides support that extends far beyond supporting people who learn. She is a CPR instructor, car seat safety tech, I'll get it, childbirth educator, doula trainer, and so much more. More often than not, she can be seen doing community work as chair of the St. Louis Doula Project or sitting as a secretary of the St. Louis Community Health Work Coalition. Most recently, Lakeisha and the St. Louis Doula Project was instrumental in the passage of Board Bill 61, which helps to provide logistical support for abortion services. Lakeisha's goal is to support the community as best she can, while also assisting other community doulas to find their place in the communities they serve. You all give a warm welcome to our panelists.
So we're going to start talking, and our topic today, again, is Medicaid and reproductive health. We know that the conversation about reproductive health can be expansive, and should be expansive. However, today, we're only talking about Medicaid and reproductive health. So all of those other reproductive health questions, if you have them, write them down. We'll give it to the health condition, and maybe they'll have another town hall about that particular topic, okay? So today, we are going to, think about these questions. We're gonna take them one at a time. But when we talk about Medicaid and reproductive health, we're gonna ask our panelists, what has changed? What has not changed? What is still unknown and undetermined? And how do we navigate through all of this to strengthen reproductive health? And we're gonna do that in like an hour, right? This is gonna be a good conversation, a lively conversation. But we are going to let our panelists do the talking, and we're gonna start with question number one. Again, as we talk about Medicaid and reproductive health, our first question is, thinking about 2023, what has actually changed? This is
From a birth work perspective, I would say that there's been an increased mention of doulas and community health workers and all that stuff in, rooms where policies or changing. But we've been here for a while. So I'm just glad that the conversation is changing and we're now, being brought up as part of the conversation. I would say that be a part of the conversation, as opposed to just being brought up, because then get the perspective of what is like actually being on the ground in the community.
Miss Redditt, can you hold the microphone a little closer, just so we can hear you in the back?
Okay.
Oh, much better. Thank you.
Oh, I am louder. You know, just so that that community is a part of the conversation. And so I think that's and what's happening.
I think what's really starting to change from what I'm seeing is a lot more awareness of what Medicaid really can offer, both for the patients we serve and in the medical community and in our communities at large. I think that a lot of people are starting to really understand that their Medicaid is so much more than just health insurance. It is care management workers, it is social worker support, it's transportation support, it's housing support. And so I think that the awareness and the understanding and the education of that is starting to change. And what we need to change is getting more education and awareness. I talk to a lot of our physicians in the community, and Dr. Tepe knows that as well. And even a lot of our doctors don't know that the patients they see are eligible for breast pumps or belly bands. And so they don't communicate that to their patients because they don't know. And I spend a lot of time talking to our doctors and our nurses and our other healthcare staff about what really Medicaid has in the full spectrum of services there are, and how that could really help when we're looking at the whole person and their whole life, and how much of those other social determinants of health and other things contribute to their health and well-being from a physical standpoint, but also from an emotional and psychological standpoint also.
Well, excuse me, can you all hear me? I can scream louder than this if I need to, but I won't. So from my perspective as a legislator, what is changing this year going into next year is a change in the makeup of the legislature. And I'm going to specifically talk about the Senate, where I am serving till the end of the year. One of the other senators who is termed out along with me this year is a senator who held up the bill to get postpartum health care for a year. Right now, based on your income level, you can get it for 60 days after you give birth. Well, I don't know how many of you are moms who have given birth, but the first 60 days, if I remember correctly, a long time ago, those are hard and you're just dealing with getting done and adjusting to this new life in your home and this new schedule. And if you have some healthcare issues, sometimes they show up then and sometimes they don't. Now, you heard, if you were listening to the list of bills, that a few years back, I was able to pass mental health care extension for women postpartum. And that was accepted by the legislature. The same legislator who helped me navigate through that process, is the one who blocked the extension of healthcare for a year for whatever, a new mom needed. And, the way he did this was by trying to defund Planned Parenthood on that same bill. And while Planned Parenthood, as we know, and nobody in the state of Missouri gets reimbursed through state taxpayer dollars for providing abortion, we know that places like Planned Parenthood provide all kinds of other healthcare services to women and men in the community, and we need them. We need the providers to be reimbursed in order to continue providing services to the low-income families that need them. So the change in the makeup of the legislature is interesting. It gives me a little hope, but I also know that with a supermajority of people on one side of the aisle versus the other, whatever that supermajority decides will or will not become law. They don't need people on my side of the aisle, a Democrat, to pass anything that they want right now. So I guess without saying who you should vote for, I think you and everyone you know should make sure that you vote and make sure that the person that you're supporting in your community is someone who supports these issues that we care about, including reproductive rights and healthcare. I'm a senator. I can filibuster and talk forever, but I'm gonna.
Good morning, everyone. So, we're just sharers up here, we're sharing my, to add on to all the things that they've said, I think what I have noticed from my vantage point as well is more discussion and more inclusion of community in what it means to have reproductive health, right? We don't need a bunch of needs sitting up here talking or making all of the decisions. I have my perspective, have my education, right? Delivered thousands of babies, but that doesn't mean I'm always the patient. That doesn't mean I'm always the community member. And so there's a big momentum, and there's a lot of discussion around it, and that includes community health workers and doulas. We are all needed at that table. All of those voices need to be heard and they need to be valued, which is where Medicaid comes from, right? We tend to value things and change systems when we have financial resources to do so. So there's been a lot of change in that, and that's really positive to see, because we know we can't take care of pregnant women appropriately in a 10-minute visit just in 6 to 9 months. It's just not possible. I will also say the Medicaid, thank you to all the people in the room, because I'm sure you helped and voted. People of Missouri, right, that Medicaid expansion actually happened. That is also a game changer. You know, with pregnancy, outside of pregnancies, you can't just be healthy for 9 months. It doesn't work that way. We all know that they actually have the systems in place to be able to do that and to center women. Their lifespan is really, really important. And I want to end on an example. So when of the power of Medicaid and access. So when Medicaid expanded, this is maybe a little smaller, but when they expanded coverage and billing reimbursement to us to do long-acting contraception, IUDs, and Nexplanon, right, in the arm, in the hospital postpartum. So we could actually bill and get reimbursed for it if we did it in the hospital, which is
high quality standard of care. When that happened, hospitals totally changed our process. We advocated, we changed our process. So not only did it benefit Medicaid women, it benefited all women because we got the system and the hospitals and all of us to change. So this is not just a conversation about contraceptives, I realize, but it just goes to the power of what you can do and advocate, and that Medicaid is expanded. It helps all of those women, but it also changes our systems because we listen, hospitals listen, clinics listen, the money. It's just how it is. So it's really, really important.
And let me say as the moderator, because I can, that when we talk about issues that tend to be polarizing, let's stop looking at the color of the skin, because oftentimes that is so blended and it's different. So let me give you the message I'm trying to give you in this manner. What we do for the least of our people takes care of all of our people. So if we take care of the people at the bottom, they rise and they become the people at the top. So for the people at the bottom need support services more than the people at the top. It's not an inequality issue, it's an equity issue. And when we make the least of us better, we all become better. So let's just keep thinking about that as we have conversations, as we think about, as we process questions that are asked of us in terms of how we create policy that includes support for the least of our people. And let's have all the creators at the table and not just the people at the top telling the people what's best for them when the people can actually tell them what they need, right? Okay, not a senator, but I can filibuster.
I just want to make one comment about talking about the people at the table, because there's not just one table. So, you know, we have a group of people in this room, all of you who are amazing. And you need to talk to each other and you need to talk to us so that we can figure out what's going on. But there are many tables out there, and doing the work inside this room is one thing, but it's only a piece of getting to all those tables. So I just want you to keep that in the back of your mind, that no matter how hard you work doing what you're doing now, sorry, we all need to do more.
Snaps to that. You know, you heard a lot of different perspectives here on the panel. Community perspective. Insurance provider, payer perspective. Elected official perspective. Health institutional, clinical perspective. How diverse this topic really is. So you heard about the things that are happening. What hasn't changed? Ooh.
There we go. This is a big one for me, and I have been waiting to talk to you about this, so I'm delighted to pick up the microphone yet again. Sorry, you guys. But here's what I want to talk about. What hasn't changed yet is the initiative petition process, the very process that was utilized to put Medicaid on the ballot because Missouri's legislature was not willing to pass it, even when the federal government was willing to pay for 100% of the expansion. Missouri legislature turned its back on that offer. The way we got this done was the initiative petition process. The issue was put on the ballot and we, Missourians, voted on it. We didn't agree with the legislature, so we got that done. That process has not changed, but there are a lot of bills that were trying to be moved during last session and before to change that process, because frankly, the people in charge in the legislature are willing to take away your voice in order that it's their voices that matter. And this is going to be something that every one of us who cares about getting things like Medicaid expansion done needs to protect. The initiative petition process. Right now, just really briefly, we have 8 congressional districts in the state of Missouri. It requires for us to get a constitutional change, 8% of the people in 6 of those 8 districts. So I have numbers here. That would be anywhere in a congressional district between 25 and 33,000 signatures per congressional district in the state of Missouri. They want to make it instead of 6 of those congressional districts, all 8, and they want to increase the number from 8% to even higher. Plus, they want to charge by the page for people to turn in an initiative petition. This will take away our collective voices. We cannot let this happen. So while you're looking hard at the issues we care most about, the end game of making sure people get services, we have to pay attention to the processes that will get in the way if we're not watching. Okay, I'll go next. What hasn't changed? There's a lot from a Medicaid perspective that I am working to change, hoping to change, waiting will change. One that Senator already mentioned is extending coverage after that 60 days for our moms. The Missouri Maternity Morbidity and Mortality Report came out not too long ago talking about the death rates in our moms and how death in our communities are different based off of private health pay versus Medicaid, race, socioeconomic status, and moms losing coverage after that 60 days is a big part of it. A lot of those deaths happened after those 60 days. So that's a huge hurdle for us to get coverage for our moms and care that they need. Behavioral health care, mental health care for our citizens also is huge. There's also not enough resources, right? Oftentimes, if I refer a patient to a psychiatrist, it's a 12-month wait for them to get in. And I don't know about you, but I wouldn't want to wait 1 year if I need help, if I need to see a doctor. There are just not enough resources to go around to serve the communities that we need. And there's a lot of creative ways to work around that. One good thing that came out of the pandemic was we learned how to use telehealth. We learned how to expand services. We learned how to reach people who are outside of our communities. We learned how to better reach people in isolated areas, rural areas. But we also know people in the inner city also can't get care. In St. Louis, we're lucky we have a lot of hospitals, a lot major academic medical centers right here in town, 2 of which that are less than a mile away from each other. And a lot of our folks still can't get care, or it takes months and months to get in. So those are some things that need to change. One area that I am particularly passionate about and working on is our substance use, especially substance use in pregnancy. A lot of stigma around that, a lot of folks afraid to reach out and get help. And then if they do, not always a lot of resources there or where they need it or when they need it. And that's something that I've seen really need to change. In the pandemic, I've been tracking our substance use in our babies that end up in the NICU, the neonatal ICU. And over the course of the pandemic, we've had at least 40% of our babies in the NICU have some type of substance exposure in utero. That's a huge number. And that could really impact the baby's life, not just as an infant, but as they grow and as they develop and as they become adults. So really lifelong consequences to our communities, and to the health of our citizens also.
As Dr. West alluded to, the expansion of care in the postpartum period is extremely important. Doulas have been, especially in St. Louis City, with the ARPA funds that came out, there's, you can put in RFP and all that stuff. Pages. And being a community doula, I don't have half the stuff that's on it, so how am I gonna use the funding to be able to help the community if I have to go through all the red tape of getting the funding? To be able to help those people. And so that's the one thing that, even though, yes, we have this funding available for you, but here's all this red tape. So for community doulas, it makes it very difficult for us because we don't have a hub to go to where we can say, hey, we're part of this particular organization, and use that hub in order to be able to use that funding and all that stuff. We don't really have that right now. So coverage for doulas statewide needs to change. As a community health worker, I remember when I first started out, I was sitting in the statewide meeting in Jefferson City, and we were trying to get community health workers covered. And because I'm dually trained as a community health worker and a doula, I'm like, hey, we need to get everybody covered because doulas and community health workers kind of have similar, we cross paths by a lot of things to do with community health. So, but it still hasn't changed. We had some movement in some insurance companies. I know United Healthcare has done something like a doula pilot or something like that. But even with that, it's drowning out community doulas who are not necessarily connected to any of the boards, or just independent business owners like me. So even though we have these big things coming through the pipeline, it's drowning out the community itself, the people that are like on the ground that are not part of these large conglomerates. So that's something that really needs to change.
As my husband would make fun of me, 3 degrees. We got it. Right. So, yes, work to be done, right? That year postpartum is gonna be a game changer for people. And I think we need to continue to advocate for that. Right, those first 60 days, it's like barely had her head above water, right? And it takes a village. I mean, I was not alone during that time, right? I had lots of people. So that is a game changer. We know that a lot of maternal morbidity and mortality happens in that postpartum period, and it's it's farther out than the 60 days. We also know some of that is hypertension, right? The biggest ones. But even outside of, say, the medical office, even hypertension, going to homes, right? We need the coverage of doulas, community health workers, to help with that. You bring in mental health, right? So after hypertension, mental health, depression, suicide, anxiety, those are some of your biggest drivers of morbidity and mortality in that postpartum period. And I'm very sad to say it has not changed. Violence. Our women also die from homicide and domestic violence and intimate partner violence, especially in that postpartum period. And what really brings that to light too is the data, and this is getting a bit better in Missouri, right? We just had our maternal mortality review come out, but without that data, how do you know where to look, right? Maternal death doesn't happen to, say, one clinician often, if at all, in your career, right? So you need these kind of statewide reviews to see what's happening, where it's happening, who it's happening to. And without the state supporting, thank you, the Maternal Mortality Review Board, right? And having that data come out, we never you know anecdotally, right? You know in your heart what's going on, but you need that data to back it up, especially if you want to change these systems. So we still have a lot of work to do. We are getting so much better, I think, with the coverage regarding those issues outside of the clinic visit. In my experience, actually, our preterm birth numbers are getting much better, which is great. Low birth weight is not getting good, but that's a whole other kind of process, right? That's anemia, nutrition, inflammation, toxic stress, racism, iron deficiency, you can go on and on. So ensuring that you have resources to support those things. And Dr. Wessels talks about nutrition services and housing services, transportation. You need all of those things, not only during pregnancy, but that was one of your.
What you hear, common themes around barriers. Whether we're talking about the process being broken through the accessing or having a process where we can have quality policies or creating more opportunities on the ground with folks that are providing that care to be able to apply, to have the ability to be able to access the kinds of resources that are necessary. Or just having the knowledge that there's resources that exist to help be the bridge. What you heard was barriers. I can't wait to get to solutions. I'm okay.
But before solutions, we don't always know what we don't know, right? But we try to think about, as we move ahead and get better, what don't we know, or what would we like to know? So for the panel, what is still unknown or undetermined?
Third time's a charm. I would say the biggest thing we don't know right now is how, like, we're getting there, the maternal mortality, the newborn and stuff. We don't know how pandemic actually affected our already dire maternal and infant mortality rates that we have. We don't know if that gap has increased or come back down, and I'm guessing increased. Or how the overturn of Roe v. Wade is also going to affect that, like going down the line. We don't know those things yet. And so the work of the doula is just like, we're trying to figure it all out and figure out how we can, from a community perspective, bring awareness to those things and educate people on that. But for me, those biggest things, where are we? Where are we with this? So that we can know what we need to do and how we need to mobilize.
I think from my perspective, what we don't know is really how do we get to the root of a lot of our issues to help these folks move forward. And what I mean by that is we have a lot of programs and things that are wonderful that help people in certain areas, but don't get to the root of the true issue. So we have transportation services, we have nutrition services, which are wonderful, but it doesn't necessarily get to the root of why there are these problems to begin with, right? So if we look at trauma as one of the roots of these issues, right? Trauma from domestic violence, trauma from racism, trauma from chronic poverty. And we know too, in the medical literature, in the psychological literature, this trauma lives in our bodies, right, for our whole life. And that trauma can come out in a lot of different ways. It can come out as depression, it can come out through substance use disorder, it can come out as living through the cycle of violence in your family that you experienced as a child. So how do we really get to trauma-informed care to look at the roots of those problems for people, right? Because we can help give someone a ride, we can help give someone a meal, but we're not getting to that trauma and healing those deep wounds that we see in our community. And that I don't have the answer to.
So again, from my seat, and the reason I think I was brought up here was to talk about this from a policy and a legislative perspective. And these problems, everything that I've heard here is true, and it's hard, and in some ways, I think people like me go in and we try to do things and we keep attacking things in the same way. And there are many of you who have been to Jefferson City to talk to our state legislators, and I think it falls on deaf ears, and sometimes it does. But I will tell you that from my experience, building relationships with legislators, even those with whom you disagree on almost everything, is the only way we move forward. I'm going to try to make this quick, but this past year, or this past 2 years, there are 11 women in Missouri's Senate currently. That is more than ever in Missouri's history at one time. Over the past 200 years, there have been a total of 1,118 senators who are male. And over that same period, 36 women in Missouri's Senate. The Missouri women, we came together and decided on both sides of the aisle that we were going to promote literacy around the state. We ended up as one of our tenets, or one of our pillars of how we were going to do this, was to write a book for kids. We wrote a book together, each telling our journey to the Senate, and an organization printed 10,000 of them. They're out in the hands of kids around the state, all of them are. Okay, I have the last 5 boxes because they're going to another. But all right, so all of them are out there. But what happened was these Missouri Senate women on both sides of the aisle, because we had worked together and gotten to know each other on a different, more personal level, we needed to pass something really important, the federal reimbursement allowance that nobody ever talks about, but it's money that draws down dollars from the federal government to pay for healthcare costs in the state of Missouri. A male colleague had tried to put an amendment on that would actually outlaw certain forms of birth control. The 11 women came together and said, no, we're not going to stand for that. They ended up pulling that off, and we ended up getting the clean federal reimbursement allowance bill passed, not for just 1 year, but for 3. It was an historic moment. What I'm telling you is, it's really good to get to know your legislator and to talk to them until you feel like you've told them the same thing 97 times, because they have a lot of other people coming in and talking to them too. You may feel like you're repeating yourself, because you know what you're there to talk about and it's in your head. Trust me, there's a lot of empty space in ours. We need to hear it again and again, and you need to fill that space. And you need to find colleagues in rural areas who are suffering the same high maternal mortality rates as you are, and make sure they're talking to their legislators in other parts of the state. This stuff matters. Building those connections matters. It's the only way voices of the constituents of all of ours who aren't able, for a variety of reasons, to speak up for themselves, need you to be at that particular table on their behalf. And you need to bring their stories with you. I don't know that, I can't remember if that answers the question, but that's what I wanted to say.
And I agree. So in talking across the table, right, even if you may not agree with someone, I think the same can be true. I share many experiences with my patients or the community, but not all. And so continuing to, I would say, try to be humble, right, and listen. You know, don't always you don't know what you don't know sometimes. I don't know what's important to Liz in the community when she's self-employed. I don't know how she wants to be reimbursed. I would need to listen to what that should look like, right? I could make something up and that probably wouldn't be the best thing for that person or that position, right? So I think the number one thing is to listen to almost anyone, right? And that's hard to be examiner too. I was not trained in that way, right? I was trying to listen quickly. And then try to make decisions and offer suggestions, right? And the treatment plan and move on. And I think what all this is talking to is that individually, right? I think as I get older, I'm better at listening to patients as well. And the Elevate Collaborative I mentioned in the opening, that is a lot about listening as well. That's group prenatal care, right? A different way to do prenatal care that centers the woman more than just not what I have to offer in education or advice. It also, I think, focuses a bit on what else is unknown, and that is how is the healthcare system and how our physicians like myself, who are kind of traditionally trained, right? How are we going to accept all of this new influx? We're not always invested, right? We're not always welcoming them, changing our ways, or listening to others. We're highly educated, right? We became experts probably for a reason. Maybe that's personality. We are passionate about what we do. But I think some of the unknown is how our healthcare systems, right? How our professionals will react to all of this new information and news. There are a lot of us out here who are very, very supportive, and that's why we went into this job, right? But there are also systems and others that are a little stuck.
So as the moderator, what is unknown? What if we were well? Right? So a lot of healthcare right now is crisis management, in my opinion. So to me, what's unknown and what's undetermined is how well will we be if we're all well, right? So something to really think about, something to make your wheels spin, something for Angela Brown over here to have another thing about, but don't ask me because I have asked the question, I don't have the answer. But there's a lot that we don't know, right? And what if the system that we had stopped adding chips and started changing the dough, right? So first of all, let me say, I didn't make that analogy up. I got somebody in my life. But the point is, if you've ever been a baker, been around a baker, or was a baker, right? It's the butter, the flour, the sugar that really makes up the cookie. You can add sprinkles at the end, you can add chocolate chips, you can add caramel, and it'll just change a little bit of the flavor. But the substance is changed in the dough. So what happens if healthcare changed the dough, right? So when we have these conversations about equity and diversity and inclusion and how to do this, how to do that, and who should be at the table and what's your perspective, all of that should be in the dough. Not bring the dough and say add your little chips, because that's not enough. Okay, next. So as we talk about changing the flavor and changing the dough and changing the makeup, how do we navigate through all of this to strengthen reproductive health?
I'll start. Well, I think one of the things we can do to change is start celebrating, right? Start celebrating women, start celebrating families, Black families, white families, rural families, immigrant families, right? Start celebrating them all. They are really strong people doing great things all of the time. celebrate our workers, right? From the physicians to the community health workers and the doulas to the nurses. Many of us have secondary trauma from just lots of different things, right? We've been through COVID too, we've been through lots of things. This is hard work, but in the root of it, it is joyous. I mean, I still get up at 2 a.m. to go deliver a baby, right? I sure wish they came 9 to 5. That would be fantastic. But there's still nothing better than seeing that little miracle happen, right? So there's so much work to do, but in sitting in a panel and sitting in a room like this and having the conversations, I know this isn't really an answer, but to talk about where the gaps are, what needs to be done, how do we change the dough, but also celebrating how strong we are and know that we can make a difference. Things are moving, we will make a difference, right? We cannot give up, that would be unacceptable, right? We can't give up for women, we can't give up for ourselves, we can't give up for our families. So celebrate all the work that you do every day, celebrate why you're here, and go out and keep talking about it. Everyone, even if they don't want to listen.
This is tough for me, but I think that, you know, unfortunately, based on what the Supreme Court has done, I think what the Supreme Court has done is unfortunate, but it also presents a great opportunity. Because this is choosing to have a family or choosing not to have a family, that's on everyone's mind. And so we have to, this is not a chocolate chip analogy, but we have to strike while the iron is hot. This is on people's minds. So let's talk about what healthy families looks like. And healthy families are families who want, maybe before they got pregnant or after, decided that they want to have children or they're able to have children. Healthy families means also being able, in my view, to make a choice. And sometimes it's a choice based on all kinds of reasons. And I don't want to be the arbiter of whether your reason is good enough. And I don't think the government should be either. So I think that, you know, part of this gathering, thank you very much for this. Part of this gathering is to talk about this issue, and we cannot let it fall back into non-conversation, especially in a stage where so much is on the line. We think maybe we could bottom, but no. Let me tell you, there is more to come, and there's more to come in this next legislative session. You will see a new senator she's already done it as a House member, try to introduce a bill that will make it a crime to help somebody cross the state line. There is lots more to do, and we need to celebrate healthy families with or without children. And we need to put that to the fore. And how do we make sure that we're doing that? We find that darn table that's waiting for that is there, and we push our way into it, right? It's not always going to be welcoming to everyone. We have to push our way in and say, this voice, my voice and the voice I represent matters too. And I'm so delighted to be in this room with so many people who are here and paying attention and stuck listening for now, but listening to us. So thank you. And when we're done, may I make a quick announcement? And thank you. One thing I think I can add is coming together with a unified motion forward, right? We each have a piece of the puzzle. We're each a piece of the puzzle in this room, but we need to put ourselves together to form that big picture, right? And we need to move forward in lockstep. I think each group is each doing great work, but oftentimes they do that in silos, they do it alone. So getting together to, like we are now, working together and moving together forward with a huge force instead of just our individual voices, I think will make a huge progress.
And last but certainly like not least.
I was gonna say that, as, business owners, insurance companies, clinics, and stuff, a lot of times we're concerned about like the terms that, but we also have to remember that we're serving people. And so we have to also put heart behind the work that we do. And do it with love. Because when we keep looking at numbers, we miss people and they start falling by the wayside. And so it's important for me, everything I do, I don't do it for recognition, I don't do it for accolades or anything, I do it because I love the people that I serve. And I think that's what keeps me going, and keeps me, I don't care if I make money off of doing it. Like, I really don't care. I've taken a lot of free clients before. I've done a lot of free things, or people just call me and just be like, hey, I'm going through this. And I'm like, hey, I'm on my way. Here's $25 to help keep that real quick. You need to get take you to the store. Like, I'm not doing things because it's going to bring me something back. I'm doing things because it needs to be done. You know what I mean? And so I think when we work from that, sometimes it's a little bit more helpful and we reach more people and people are more receptive. So that's what I have.
So we want to thank the panel because that is our discussion. And Laura and I were just realizing that we have not given the audience an opportunity to ask any questions. We have time for probably 3 questions. And so if 20 people raise their hand, I'm going to ask that 17 of you write it down, and we're going to turn it into the Regional Health Commission so that they can get those questions answered, even though it's not in this forum. Okay, but there are people that have burning questions. Laura's going to try to tag this side. I'm going to try to tag this side. Our panelists have their mic on the table. 1, 2, 3. We got a question right here. Hey, questions from 3 guys. I love it. I love it. Laura, you first go. Can you hear me? Okay.
Good morning. My name is James Robinson. Can you all hear me? I'm the chief of staff to Senator Angela Mosley. I like to say, unfortunately, she wasn't able to be here today, but I'm certainly keeping up with your questions, and she's very concerned about what you all are concerned with and how you all are approaching it and the impact that you all are making. And I want to relate all of that back to her. Now, my question is, and I'm making this germane to the senator also. A young lady asked us to introduce a bill. It was kind of late in the session dealing with holistic healing. And what came up with that was I would say there's not much of a welcoming committee for that type of practice of medicine. And I was considering now as I was help drafting the bill, what type of impact would that have? And a lot of times in the Senate, we don't want to give, when I say we, I'm not a senator, but because I represent the senator, I'm saying we don't want to give people the idea that they don't have hope. We don't want to give false hope, but we want to give them hope from the fact that something can always be accomplished. It may not be totally accomplished to what you initially desire, but hopefully we can get some of that out of it. And Senator Swoops is a perfect example of that. She has always got something on that floor out of somebody, and I have witnessed that several times. So my question to all of you all, I guess you hit me in the back to earlier. How, and this is to the panelists also, how are you going to address the, swell against not accepting that type of practice, holistic medicine, as an acceptable field.
So I definitely don't have the answer. I definitely don't have the answer for this per se. I think there's enough healing to go around. Quite frankly, I think when you get down to nitty gritty things, you need to look at scope and education and, maybe it's not just education, experience, right? Look at outcomes, where the role is, where the supports are. But I also think until we're all, whatever we think of as thriving, right, and doing our best, I'm not sure you would close the door to any one thing. It takes a team, it really does.
Hi, I'm Fred Rodnick. My statement is, I noticed it's all about 7 or 8 men in the room, which is concerning. But other than voting, what would your dream be for the men in the state of Missouri to support the work that we're talking about today?
Well, from my perspective, you know, everything that the women in this room are doing and the women who come and advocate are doing, we need men to be there too. And, you know, in Jefferson City, since the vast majority of people in the legislature are men, I think hearing from another male to provide that perspective, even though you may not be the person who would give birth or who would give birth as a result of a terrible situation, providing a perspective of the importance to you, to the men in the room and the women, I think really adds to the story. I will tell you that, well, it will add to the story, and especially personal stories. How forcing a woman to carry a pregnancy to term has impacted you and your family, or how different situations along those lines. So I would say you are an equal partner in this. No woman has ever, well, maybe I shouldn't say that. Except for medical science, which can do amazing things, but no woman has ever gotten pregnant without the help of a man. So we're there to support that woman, whether she chooses pregnancy or not. Thank you.
I would also say this is not safe for Medicaid or policy or sitting on committees, which I do think there's a sense, right? There's a seat for all of us to stand up for this. But I think we're also, and I think it's slowly happening, trying to do a better job in healthcare as well, in welcoming fathers and the male support. If it's there of the family and the pregnant person, and that is something we haven't traditionally, I don't think, been very good at. And so I think there's some work happening for two.
Moderator privilege for you. Let me just say that men are as affected as women. When we talk about maternal mortality, who's taking care of these children when the mom doesn't survive? Or when we talk about maternal morbidity. When we talk about, we talked about maternal leave in this country, we really should be talking about parental leave, because men are affected and are part of the family. So however you connect with your family, that's the perspective you should have, right? So that's how men can be involved in the conversation, because parenting is just that, parenting. Parenting doesn't have to be gender specific, right? Medical science makes you some sort of female by birth, by design, by desire, all of those things. We're not going to go down that road, but that's only part of it, right? Families consist of more than a uterus. So there's plenty of work for you to do, and you personally, thank you, because I know you do a lot of work. A lot of what you do. We're not even talking about that. We're gonna go to Laura and our last question. Oh, I'm sorry.
I was also gonna say, even if you're not a father right now, you're an uncle, your brother, your cousin, you know somebody who is going through some of these issues, and it's important for your voice to be heard too. So you don't have to be a father in order to stand up for women. And so just kind of keeping that in mind. So yeah, just use your position as a male and as a human, exactly, to deliver your own experience and what you know from your experience.
Hello, my name is Jose Sandoval. I'm an intern here at the Regional Health Commission and a law student over at St. Louis University as well. And my question for you all is, in light of the Dobbs decision that Senator Schiff has brought up for us, there's a variety of legal issues that came up in the wake of that decision, such as the conflict between state abortion bans and the federal EMTALA, the Emergency Medical Treatment and Labor Act. You know, providers were hesitant to provide emergency stabilizing care that resulted in an abortion or termination of a pregnancy because that was, you know, detrimental to the health of the mother. And there's also secondary issues that are being brought up regarding access to contraception. You know, that right at the federal level is starting to look a little dubious. So what can the state of Missouri do to clarify for providers the conflict between the state's EMTALA and abortion ban and shore up our rights to access to contraception? I know that's too
Okay,
there.
so-
My apologies.
I'm gonna have to take moderator privilege on that question. Because that gets into a whole different trajectory besides postpartum Medicaid expansion. So I will ask the Regional Health Commission answer that question for you, because some of us in this room cannot participate in conversations about abortion. So I'm going to ask you not to answer that question, but I'm sure he will be available when the panel is over, so that is not a part of the discussion. And so I apologize if all of those that want to hear the answer to that question, as soon as we conclude this session, you're welcome to have whatever discussion you would like about contraception and abortion. Are we all okay? Okay. No, I understand the answer is no, that's okay. And that's okay. So with that, we are at 10:27. Your next,
Senator,
sorry.
Would you mind if I made an announcement? Is that right? So, thank you. I'm only doing this because I think it will help a lot of the people that you serve. So for the 8th year now, my office puts on a healthcare fair that is free to everyone. We don't ask for IDs. I don't care where they come from. They get free flu shots, free COVID shots, vision screening, blood pressure screening, dental screening for children. All kinds of services are provided. The Department of Health will be there. We'll be there to help people fill out insurance information and provide them information. We provide trigger locks, so your guns aren't used accidentally in your homes. And it is this Saturday from 10 to noon. It is at Brittner Senior High, if you'll write that down, on 9100 St. Charles Rock Road, 10 to noon, Brittner High School, all free. Please send anyone you know who might use free services to that, and thank you for letting me have my commercial.
Thank you, thank you, thank you. Please give our panelists and moderators. Really appreciate having them all here, and I may be a little biased, but it's always wonderful to start your morning with an amazing group of women. Who, I feel like only women can say, think about all the issues ahead and all the work that needs to be done, and like, let's celebrate, let's show love, and let's keep pushing forward, right? You know, I'm a woman, so I'm a little biased at the way, that just the way that, as we think about this conversation and all the perspectives that we intentionally have at the table, that the Regional Health Commission, we do center relationships, and understand that we need all voices represented at the local tables that we have created, to push change forward. And so we're gonna break off into some groups, continue some round tables to continue this discussion. We want to leave with some hope, as we discussed and some actions that we can go away with, as we develop our different policy agendas and our work ahead. And so that is the morning. We're gonna actually step out while they do rearrange the room. We thank you all for joining us on, YouTube or Facebook. We have our partners here that we forgot to acknowledge. That we're gonna take a moment to acknowledge our partners, legal services, with Missouri Generate Health is in the room. The St. Louis Integrated Health Network and the Hayward Health Network are our partners that will be leading our remaining session. We thank you all for joining in with us. Understand where you are. Never mind, understand where you are.
All right, just gonna share. If you could, I'm putting y'all, IHN, representatives from IHN, can you please stand? For those people who are already around. So those people who have registered and wanted to participate in the holistic care and reproductive justice roundtable, that will be with IHN, and they'll be in the chamber around the corner, they'll be guys to help you. Those of you who are with Generate Health, can you please stand? Show, wave your hand. Thank you. Those of you who have signed up for the racial equity and maternal health policy, thank you so much for facilitating that conversation. That will be in Central Room A. Good news, it's right here. The partition will divide, it will be right to my right. And those of you with legal services in Eastern Missouri, please raise your hand. Thank you so much for being with us this morning. Those of you who signed up for health advocacy and improving access to care, that will be in Century Room B, which is right here. Right? And then those of our friends from Behavioral Health Network, you can stand up, raise your hand. Hello, good morning. That will be Medicaid and mental health concerns, and that will be in Century Room C. So you can take a break, grab some water, refreshments, and we'll meet you back here in 2 and 2, like Chuck Woolery used to say.
Sorry about that.
I know, I didn't know that.
She does look for